what would be your kind of pearls of wisdom of how to approach that person and how to support them?
If the person is open about it, just being there for support and just understanding that sometimes they're going to have bad days. Like it's hard because if you don't know anything about infertility, you don't know until you know, right? And you don't know until you know somebody. And one of my now best friends, we had met during rehearsals for, I used to be a dancer at Universal, and she was, I was kind of sitting in the corner sulking. She's like, "Oh, what's wrong?" And I was like, "Well, I just started my cycle and this is our last time trying before going into IVF. And I'm really scared and I don't want to do IVF, but we've been trying for over a year now and we're done." And from that moment on, she was like, "I'm here for whatever you need. Wine nights, girl time." And honestly, she has been for every moment of every step that I have taken. She has just been like, "I'm coming over with a bottle of wine," or let's go do something girly. Let's go get our nails done or something. And just that, she didn't have to do that. She didn't have to be so nice. She didn't have to be so supportive. And I think a lot of the times, especially as a performer, you're putting on a front, you're putting on everything's fine, I'm okay, and I was trying to be so positive, not only for myself, but also for my husband and my family. And there would be times I'd just be watching TV and just break down crying. And so, yeah, I think that if you do see someone who's struggling with infertility, even if, and they always say this with social media, like you're only getting like half the story, right? Like you're the smiles and everything that's all good, but there are a lot of bad days too. And just to be there for those bad days, not just for those good days.
Not just that conditional support.
This is Dr. Laura. Welcome to Mind Candy Podcast, where we empower women's voices and tackle current issues related to psychology.
All right, everyone, welcome back to Mind Candy with Dr. Laura. Today, I have an amazing guest who happens to be a friend of mine as well, Ansley Van Epps. She's a photographer and owner of Van Epps Photography. Today, we're going to be talking about a really important and I think for a lot of people, sensitive issue of IVF and infertility. Ansley, would you like to introduce yourself?
Hi, I'm Ansley. Like she said, I am a photographer in Tampa, Florida. And I actually photograph newborn and maternity. And I'm also struggling with infertility and pregnancy loss, which is kind of, I think up until just recently, like a taboo subject to talk about. But here we are, and we're going to talk about it.
I'm so glad we're going to talk about it because I know when I had my own pregnancy loss, which many of us do, I was devastated and I was like, wow, I am so alone. And the doctors told me that it's at least 1 in 5, and that's what's reported. Women have a pregnancy loss. So I think it's a really important issue that we face as women. And I'm really glad you're here today to kind of shed some light and validate a lot of experiences that I know I faced, I know you faced. I think we both probably know quite a few women that have also faced it as well. But I wanted to get started. Just a few things that I think will be really fun for our listeners before we dive in is, well, fun for me. I want to give some statistics and I'm curious what your thoughts are on them. And also really first, just kind of getting to know you. So some of our listeners may know this, a lot probably don't, but we met because you photographed one of my best friends for her newborn photos, and they were so beautiful and so amazing that I was like, I would love to get photos of me and my 2 kids. And we've worked together a lot at this point, and you're quite gifted.
Yeah.
So
Oh,
you're
thank
amazing.
you. Well, and it's always fun to photograph you and your kids. I love it.
They're little stinkers. I know. We bribe them with a lot of candy.
Yeah, we do. But you know
By
what?
we, I mean me.
They always have such beautiful pictures in the end. They're it's funny because I feel like children of today kind of know when a
Yeah.
camera is put in front of their face, like the iPhone is very much, and then so they pose and then they go back to being crazy and then
Yeah.
you pose.
Or they just are crazy in the photographs, which have been some of my favorites. But
Those
no,
are the best though. Those are the
yeah,
best.
they're like very candid. But I think genuinely, like, it's been so amazing getting to know you. You're a wonderful human and a wonderful photographer. And I'm just really grateful that you're doing an episode with me. And what an amazing topic to talk about. On an aside, for all the moms listening, I think we all know that getting a nice photograph with our kids is really difficult. I was looking through all my kids' photographs and I was like, wow, they're going to remember me looking like this, right? Like tired and a lot of them are like beautiful, photographs, and we should feel comfortable being natural, but it's also nice to get beautiful photographs that can be an heirloom for your children and just really beautiful to like hang on the wall. And so it's really helped, my confidence and it's just been a big part of what we do, the three of us. So thank you for that. And I'm sure a lot of moms, a lot of moms listening can relate to that, like not having a lot of photographs where it's not just
yeah,
wild ride. Yeah.
I can even relate because I'm never in the picture. I'm always taking the picture. And so, like we were just talking, I went on my Disney cruise. I bought the whole photo package because I'm in all the pictures. And I was like, I never get in any pictures unless I'm paying somebody else to take my pictures.
Right. Isn't that funny how that happens with us?
Yep. Yep.
Yeah. But anyway, so highly recommend listeners to get family photos, individual photos. We've even photographed my Cavalier, Rosie. She tried to do a baby photo shoot for her, which was hilarious, but you did such an amazing job. She's just a wild girl. So
yeah.
Yeah. So anyway, that's, I think it's kind of fun for our listeners to know like how we know each other.
Yeah.
And so highly recommend. If you're okay with it, I'm going to put your website on the podcast.
Oh, absolutely.
Check you out. Let's get started. So I loved this when I asked, what is the favorite part of your job? And you said snuggling babies. I love this.
Yes.
Yeah.
Yeah. It's my favorite part. Like I love babies. That's why I got into newborn photography. I even started doing newborn photography before I even had kids. And when I was struggling with infertility, I really just kind of dove into studying and I did one-on-one workshops and I really tried to grow my craft because even though I couldn't have children at that time, I still wanted to be able to be around babies. I just love babies so much. So
they're beautiful. Yeah, and what a kind of dichotomy to be in, going through infertility and then your job is photographing these newborn babies and celebrating their life. I can imagine that was a very complicated situation for you. Even the most successful couples can have breakdowns in communication. However, Compass Psychological Services provides tools to help navigate these pressures together.
It was difficult, but in my heart, my feelings are every baby is a gift. And even if I can't be pregnant now, I always had that hope that I would be pregnant in the future and that people would celebrate me just like I was celebrating them. So that's kind of how I looked at it. I know for many women that is very hard to do. I know after I lost my first baby, it was very hard for me to be around pregnant women, and I had to take a break from maternity photography because it was a struggle emotionally, and I just needed to take a step back and kind of regroup. And once I started photographing maternity sessions and newborns again, I felt kind of like that was my therapy, like that it was making me realize just how special and how important being able to even carry a child is and bringing a newborn into this world. It's so difficult. And I don't think some people can get pregnant very easily. Some people have struggles. It takes a couple of months. Some people it takes years. And everybody's on a different journey. And so I just had to kind of tell myself that like everybody's on a different journey. It doesn't mean that you will never have a baby. So I tried to stay positive, but it was hard.
I think there's so much that goes into it too. I think it's a balance of, trying to look forward and have hope for the future, and then also honoring those feelings of loss and anger and grief. I think it's an enormous, like ocean of emotions that I think a lot of women go through.
Oh yeah.
When they decide they want to have a child. And I know I work a lot with grief and I've gone through grief myself, and there's nothing more annoying than somebody going, "Oh, it's okay. It'll happen for you in the future," or, "Oh, they're in a better place," right? Or, "Oh, it just wasn't meant to be,"
Right.
right?
Hmm.
Yeah, it can be really painful hearing those kind of things.
Yeah. And we lost our first baby at 20 weeks. So I had already started getting stuff for the nursery. We were thinking, we knew it was a boy. So that was, I think, a lot of people sometimes when it's early on, I don't know why people think that just because it's early on, it's indifferent. And, you still have that bond no matter how far in the pregnancy you are. And yeah, it's still difficult. And I mean, I had to get rid of a lot of things that we had purchased because it was later, halfway through the pregnancy. So,
Mhm.
yeah.
Yeah. And I think there's like these unspoken rules, right? Of like when we can grieve and how long we can grieve and who do we tell, right? There's this, like rule of thumb of don't tell anyone until 12 weeks, right? Well, I had my loss before 12 weeks and I know people who have, and it's still awful, right? Like
Yeah.
it's still horrible. And yet we're supposed to not tell anyone and not
Right.
get support.
I
It's
think
very, very bizarre.
yeah, I
Yeah.
think that's the worst thing that you could do is like to keep it quiet so that you don't make other people feel uncomfortable if a loss does happen. Like what's I
So
get
backwards.
right. Like I felt like when I lost my son that the support was overwhelming and people were so wonderful to me and my husband. And I just don't understand why people wouldn't tell anybody. And I get that there are people who are private and there are people who are very just keep to themselves. But I definitely think you need at least a friend or a family member or someone that can support during that time because it's not easy. It's definitely difficult and emotional.
And, I think the reason behind it is always so important with most things, right? Like if you're not sharing because that's your personal choice, then, you know, I feel like that's so empowering. But if the reason is because you don't want to make other people uncomfortable or you're scared or, you don't, you're trying to take care of people before you, right? Then I think
Right.
that's when it becomes a little problematic. Yeah.
Hmm.
Yeah. Our country has a long way to go, I think, in grief in general, in pregnancy loss. It's just, wow, we're a little behind, but hopefully, with information like this going out there, that we can be a small part of kind of normalizing a lot of these things. I wanted to talk about a few. I love my research, and that's why I'm doing this podcast. And I think a lot of people don't know how common this is. My information is coming from the CDC, and the research is between 2015 and 2019. Um, and it's almost 14% of women between the ages of 15 and 49 have problems with their fertility. And the National Institute of Disease estimates that 11% of women and 9% of men have reproductive age, have problems with fertility. And regarding heterosexual couples, 15% of couples are affected by infertility. And that's probably, I would assume, a low, low estimation considering reporting numbers.
Yeah.
From 1950, the average woman had 5 children, and now of 2020, it's now 2 children. And in the US, about 11% of women, like I said, and 9% of men have infertility. So that's a pretty big number. That's like 1 in 10,
Right.
right? I'm certainly not a mathematician, but that's a lot. That's a lot more than I think maybe a lot of us would even think. What are your thoughts on that?
Yeah, absolutely. I think it's even growing. To be honest, I think that there are couples that maybe not even you don't even know.
Mhm.
There are people who don't share that with their doctor or anything. So they, those statistics might be low, is what I think. And to be honest, what happened from the 1950s to 2020?
Mhm.
What's happening to our bodies? What's happening in our food? What's happening, with products that we use every day? Are there chemicals in it that are causing these issues? Because it's not just women, it's men too. Men
Mhm.
are also suffering from infertility. And that's always the big question with me. Like, why are these numbers going up so high in such a short amount of time from the 1950s to 2020? And then I think I even saw a study, and I don't want to quote anything that's wrong, but it says it's from 2017 to 2022, it's even gone up just a little bit as well.
Mhm. My first thought was, oh, and between the 1950s and now, like, women, thankfully, have some more choices, with work and our lives. But I'm assuming that's at least part of it, why we're having less children. But I'm also,
Absolutely.
I'm also curious of what kind of, and neither of us are the expert in this, right? But I think it's just something to bring up, right? And if anyone listening knows an expert in this, please email me. I would love to have them on. But of the biological systemic reasons why this is happening.
Right.
But take it as you will, listeners. But the CDC this is the data that they've
Right.
provided.
Yeah. And very thankful for the advances in technology that have with birth control and allowing women to make their own choices, like you said.
Yeah.
But then with it, when it comes to fertility, the women that want to have the children, it's
Right.
difficult. Yeah.
And I mean, I think we should also state that, like, there's a lot of women who choose not to have children. And of course, that could be like another podcast episode. It's not the one today, right? We're talking about women who want to have children and are
Right.
actively trying. But, and that's just as, a few of my best friends that I love and are wonderful women. And there's a stigma with not having children, right? So that'll be another episode, but we want to also honor those women as well.
No more imposter syndrome. Compass Psychological Services helps you build greater self-confidence.
Regarding IVF, I think it's interesting to know that for women under 35, this is also from the CDC, the percentage of live births per embryo transfer for women is under 35 is 50%, while the percentage for women over 42 is 7%. So I guess it's between 35 and 42. It's somewhere between 7 and 50%. But that's a really large dip. And so if anyone is wanting to know anything about, IVF success rates, those are what the CDC provides. I'm also going to be linking a lot of more research in this podcast episode, but I'm also curious what your thoughts on those numbers.
I think it has a lot to do with, I mean, I'm not a doctor, but I've talked to many doctors. So when I had my egg retrieval at 32, they were like, hey, we should do these back to back to back, depending on how many embryos we get. Now, the first one we got 18 eggs, but only 5 embryos were sent to testing. And we did testing for those because we had the genetic disorder, which is what we lost our first baby from. So we didn't get any embryos back. They all came back non-viable. And that was heartbreaking. And so when the doctor said, well, we got to do more rounds, like we'll up your medication, we'll get more embryos. Our second we got 1 embryo, and our third we got 3. So the quality of embryo at 32 for me, who has unexplained infertility, they can't figure out why my embryos were not coming back like viable. And I obviously, women know as we get older, our AMH levels, which is our embryo, or the reserve that we have, goes down. The embryo quality goes down. The egg quality goes down. So if you're doing IVF, which is the egg retrieval at under 35, you're possibly have a better egg quality than if you're doing it at 42. That's most likely the biggest reason. They've asked if I've wanted to do another egg retrieval, and I've just said no. I just don't think we couldn't get great quality eggs when I was 32. I'm 39 now. I don't think that I would get anything. I think it would just be throwing money at something that's not like. And I just had all of everything tested last week, and they were like, oh, everything looks good, everything's great, we can't figure out why you're not getting pregnant, which is the most frustrating thing.
Right. Yeah, when there's not an answer to be had, it's just unexplained. Right?
Yep.
Blanket answer. Or none. No answer.
Right. And we've transferred all 4 embryos. We have 4 embryos, and only 1 took. So out of the 4 embryos that we had 1 live birth.
It's a lot. And I think that, a lot of us women, we don't get the answers. When something horrible happens to us, we're at least wanting answers to give us some kind of closure or explanation. And I think in a lot of ways, people that I know who've gone through infertility, that they don't get one. And so it can be really, really challenging to go through all of that work and basically get, become an expert in something that you never thought you'd be an expert in, right?
Mm-hmm.
And still with, not a ton of answers. And so I'm curious, for listeners going through infertility right now, what would you want to communicate to them?
Oh, find the community. Yeah, I think that when I was going through infertility, I started posting about it on my Instagram,
Mhm.
and I felt very alone because Meckel-Gruber syndrome affects 1 in 700,000 couples. And so not only was I going through loss, but we
Mhm.
tried for over a year after that loss, and we still couldn't get pregnant again, which is why we turned to for IVF.
Mhm.
Um, and I ended up finding online communities, and it was very helpful to see that other people were going through similar struggles as me. We actually, there wasn't one in Orlando, so I created one because that's where I was living at the time. And we would meet up once a month and we would talk. And the girls and I would, that were kind of the first in the group, we still chat and get together to this day. And to know that I wasn't going through it alone and that there were other people who were in the same struggle as I was for different reasons. One of them, her husband had childhood cancer, so he was the one that was struggling and she was going through the egg retrieval process and all that. Another one was decided that she was getting older and she wanted to be a single mom, so she was going through a sperm donor process. So it was like very eye-opening to not only see other women going through what I was going through, but other women going through IVF for such different reasons, and they were all coming together. And it was very helpful when I was going through IVF to be able to sit down, have coffee, and chat with other women who are going through similar things. And we had multiple meetups up until COVID happened.
Mhm. That's amazing. You made something so tragic so beautiful, and I think that's incredibly inspirational for anyone listening right now. Is making the meaning out of things that just seem to baffle us when they happen to us. For listeners who are unfamiliar with infertility or know someone who is struggling, what would you want to communicate? And I say this because I think that I went through something odd with infertility. We tried for a while, and then I, you know, got pregnant, and I was like, oh, well, there we go, right? We decide you want a baby, and it just happens, right? And that's not how usually life goes for a lot of people.
Right.
And I felt really weird. And these are for all of the listeners who, if you've gone through an ectopic pregnancy, a pregnancy that's outside of the uterus. And it was fairly early on, but I was actually in grad school at the time, and oh my gosh, I was in so much pain. I was like sweating. I was like, something's wrong. I went to the hospital. I had a doctor that literally looked like Guy Ferrari's twin. And he just dismissed me and told me I probably was like anxious, right? And I was like, no, something's wrong with my body. I called a new GYN because my GYN dismissed me as well. Everybody's telling me I'm being anxious, right? Because we're so hysterical as women,
I,
right? And I'm saying that with
I don't know
sarcasm.
why they always give that.
Yeah.
They're like, oh, you're bleeding from the head. You're just having
Right.
anxiety.
Oh, you're fine, right? It's like, what? And so I trusted my gut. So, and I was having one-sided pain. I was sweating. I was having abdominal cramps. And so the next day, the pain had moved to my stomach and
Mm,
from my pelvis. And I was like, my gut told me something's wrong. So I went to this new doctor, and within 2 hours, I was in surgery because everything had ruptured. So
mm,
I would say to those, there's a lot of different ways, right? We can grieve a loss. And I looked very much for a support group because it was really devastating. And because I had to have surgery, I had to have some of my reproductive system removed because it was damaged.
mm,
And, I'm sharing this. And if you know me, you know that I'm not a big sharer. I'm pretty private. But I think ectopic pregnancies can happen in several areas. Mine was in one of my fallopian tubes, which is the most common area. I also did not expect to be an expert in this, by the way. It's just when things happen, we want answers. And so I guess those of you listening, if you're trying to conceive and everyone's telling you that you're fine, that's great, but listen to your body. What is the worst thing that can happen? Getting an extra scan, getting an extra evaluation. So it saved my life. She said if I would have waited a few more days, I wouldn't be here. So and everyone told me I was anxious. So hopefully that's empowering at least a few
I'm so glad you
people.
trusted your gut.
I did, literally and figuratively. I'm like, this does not feel
Yeah.
good. And yeah, and it's I was worried I wouldn't be able to have kids after, and it was a problem for a while, but as you know, because you photographed them, I have two little gremlins that run my life, and I love it. But there's also hope after too, because I think those things can kind of be very complicated, as I think you and I both know. So either way, hopefully someone out there is listening and feeling hopefully a little validated about empowering ourselves to do that. But anyway, my question for you before I went off on my tangent was those of her unfamiliar with infertility, because I think we all, before what happened to me happened, I had no clue.
No clue.
Wasn't sure,
No.
right? But someone, maybe you just are curious about infertility or know someone who is struggling. What would be your kind of pearls of wisdom of how to approach that person and how to support them?
And if the person is open about it, just being there for support and just understanding that sometimes they're going to have bad days. Like it's hard because if you don't know anything about infertility, you don't know until you know, right? And you don't know until you know somebody. And one of my now best friends, we had met during rehearsals for, I used to be a dancer at Universal,
Mhm.
and she was, I was kind of sitting in the corner sulking. She's like, "Oh, what's wrong?" And I was like, "Well, I just started my cycle, and this is our last time trying before going into IVF, and I'm really scared, and I don't want to do IVF, but we've been trying for over a year now, and we're done." And from that moment on, she was like, "I'm here for whatever you need. Wine nights, girl time." And honestly, she has been for every moment of every step that I have taken. She has just been like, "I'm coming over with a bottle of wine," or let's go do something girly. Let's go get our nails done or something. And just that, she didn't have to do that. She didn't have to be so nice. She didn't have to be so supportive. And I think a lot of the times, especially as a performer, you're putting on a front, you're putting on everything's fine, I'm okay, you know. And I was trying to be so positive, not only for myself, but also for my husband and my family. And there would be times I'd just be watching TV and just break down crying. And so, yeah, I think that if you do see someone who's struggling with infertility, even if, and they always say this with social media, like you're only getting like half the story, right? Like you're the smiles and everything that's all good, but there are a lot of bad days too. And just to be there for those bad days, not just for those good days.
Not just that conditional support. And I think you brought up something that's I think so important to acknowledge is that we're talking about IVF, and not everybody has the resources to do IVF, right? And even if you do, you can end up spending a lot of money because I'm sure rarely works the first time.
Yeah.
And so price can be a huge limiting factor in people having children or expanding or starting their family. But I know you had also mentioned that a lot of insurance companies and companies are starting to cover IVF and that you're hopeful for more advances in the technology in the future.
Yes. Like I have a lot of feelings on this subject because Universal was great. We had some money that was given to my husband when his grandparents unfortunately passed, but that is how we paid for our first round. And then it didn't work. So it was a lot of money we felt that was like flushed down the drain. But then my doctor's like, "Listen, because that didn't work, we have other options to get more eggs." Like it's a numbers. They always say it's a numbers game. It's a numbers game. But we also had to pay for genetic testing. So we did, you take all the embryos, if you let's say I had 18 eggs, 10 fertilized, 5 got to embryo. They go down and down and down and down. So if we had taken those 5 embryos and transferred them, they probably, like, they wouldn't have worked. And so we sent them to genetic testing, which is more money. Then they genetically tested those. Unfortunately, when we did get one back, we transferred that one. It had Meckel-Gruber syndrome, even though we were told it didn't. So we're hoping that, like, it's a two-part question. The advances in technology will be so that I'm a rare 2%. They say, oh, 98% of the time the genetic testing works. I'm the rare 2% that it didn't work, where I lost a second baby at 20 weeks. And with Universal, they have started allowing up to a certain number of money for insurance to cover IVF and to cover the cost, which is so amazing. I think Disney was not far behind. I think that they also started offering within the past 4 or 5 years. And I've seen more and more companies, Starbucks. A lot of women in the group say, I got a job at Starbucks because they pay for infertility, they pay for IVF. Yeah, like Starbucks offers IVF, and I think you can go online and find companies that will cover IVF. And unfortunately, US military will not cover it. My husband's in the military. It will not cover IVF unless he was injured or has erectile dysfunction.
Compass Psychological Services helps you manage stress and maintain a healthy work-life balance.
There's so many hoops with insurance to go through. It's exhausting.
It's so tiring, and it's so unfortunate that a lot of the IVF clinics don't take insurance. We were also able to save a lot of money through my clinic because all of my doctor's appointments were paid for through insurance. And that didn't take out of was Universal, because that was going through military insurance. The whole thing. The whole thing. But like,
It's a whole thing.
but the medication.
Yeah, and it just adds.
Yeah. And the
Yeah.
medication itself, like some of my medication was paid for by insurance, but the Gonal F, which is I think the Gonal F is the most used medication to stimulate your eggs and your ovaries, is like $1,000 a pin. And you can use up to 4 pins a cycle. So that's $4,000 right there that you have to pay out of pocket. And yeah, so it's expensive. It's heartbreakingly expensive, because sometimes this is some people's only chance to have a baby. And yeah, I just wish that more insurance companies would cover it.
So it's more accessible for people, and it's always heartbreaking when, there's only a certain part of the population that for whatever reason, right, can do a certain because
Right.
of barriers. And I'm totally with you. I think, like a lot of things, it will be really nice when we're on the other side of history with these things, with insurance access and things like that.
I know in the UK, I think it's 3 free rounds, and then which most people need 3 rounds, is what I am starting to figure out.
Yeah, it is a wild roller coaster of a ride. There's, like you said, there's emotional ups and downs and highs and lows. And I think that one of the biggest takeaways from listening to your journey is really getting that support around you and accepting support. And I know a lot of us women it is not easy for us to accept support. And so I think that's so important to build that community. And I think social media can do some weird things, right? But it also, I think, can also do some amazing things with getting people together. And I think that's such a beautiful thing. And thank you so much for your time today. You're amazing. You're a freaking inspiration. I'm going to tag in your YouTube and your Instagram and your photography website, because it's just beautiful.
Yes. Oh, thank you. My YouTube is very old. It's actually following my infertility IVF journey. And since I had my twins, which so thankful that IVF gave me the chance to have my twins, I don't have time for YouTube anymore.
Where
Too
would you have
much.
time? Yeah, but
Where-
I'm gonna tag it just so if someone's interested in kind of learning more about your story because it's
Yeah.
so inspiring,
Yeah,
so beautiful.
absolutely.
Yeah, I've just really enjoyed chatting with you today. I hope that, those that are listening, it was it's somber, but it's also kind of also sobering, right? To know that like, wow, this is a really common set of things that happen to people. And, I always say in my therapy, it's not the struggle Olympics, right? Like, no loss is better or worse than another loss in many ways, right? But they're very personal to us. And I think that's really different. And I think that I just hope that people listening, hopefully it took some nuggets away about that you're not alone. None of us are alone in this.
Yeah. And I always say that like IVF is so amazing that it gives you the chance to have a baby, but that's what it is. It's a chance. Like, yeah, it's a chance. It is a lot of money and it might not work. And that's also the most heartbreaking thing. But, like, and that's where we're hoping that more technology and everything comes in the future and that it can be a little bit more accessible to everybody.
I agree. Well, it was wonderful to see you. Thank you for your time today. I have attached Ansley's Instagram and YouTube, and I'm also going to hop in some resources that are research backed about infertility, IVF, and I've also included some infertility support groups as well, if anyone is interested. Thank you for your time today. Hope you come back with us.
Of course. I feel like we could talk for hours.
We absolutely could. Those listening, don't forget to hit subscribe. And this is Dr. Laura signing off from Mind Candy. Hey everyone, it's Dr. Laura with Mind Candy. A quick note just to discuss, as I am an ethical psychologist, none of these subjects or the information in the podcast constitute any kind of therapeutic relationship. All of that information can be found in our terms and conditions. Everything we discuss on Mind Candy are the experience of myself and my guests, and it does not constitute advice or a therapeutic relationship. Thank you so much, and don't forget to hit subscribe.